Cleft lip surgery starts with marking of landmarks. The normal philtral column is marked, followed by the cupid's bow on right side of the lip. Opposite cupid peak is marked after taking the measurement from the normal side. Following this, the columnar base points as well as the alar base points are marked. The corresponding points of cupid's peak on the cleft side is marked on lateral lip element. Its position varies and it's generally present at the point where the white line fades. Its position is reconfirmed with measurements from the angle of the mouth and from the alar base comparing to the opposite side. Following these markings, rotation as well as advancement incisions are marked, which defines the C flap. Also, a triangular flap is marked on the cleft side for the purpose of equalizing the bulk of vermilion. The incisions are made after infiltrating with adrenalized saline, which gives the bloodless fluid on incision. Once the incisions are made, the white line is cut across perpendicularly, extending the incision on vermilion side. Once the incisions are complete, the cupid's bow on cleft side is pulled down to check its horizontalness. If necessary, the back cut is given as well as the muzzle at the base of back cut is cut to make the cupid's bow horizontal. Once the cupid's bow is made horizontal, a back cut is given at the junction of dry and wet vermilion to receive the triangular flap from the opposite side. The mucosal side as well as the orbicular ovaries muscles are approximated, followed by the skin, completing the rotation, advancement, repair of the cleft lip. Also done was a removal of a measured amount of wedge from the nasal sill on cleft side and primary rhinoplasty, wherein the skin is separated from the alar cartilages, making the nose symmetrical. At the completion of surgery, the cupid's bow should look horizontal, the vermilion should be symmetrical, nose should be as much as symmetrical as possible, and the suture line must reflect the normal philtral column. In the post-operative picture after 1 year, you will notice cupid's bow, the philtral column and the nasal symmetry are reasonable and the scar is maturing, maintaining a reasonable good appearance.